All right, thank you so much, everybody, for your patience. We do apologize for the technical delay, but we are online now, and thank you, everybody, for joining us. We know that this is a really weird time for folks, but we're still very grateful that we are able to record this, so that way people can just have it on hand. So we have some people in person. I'm going to have the people on the phone introduce themselves after that. Mr. Willie Harris, do you want to start?
Hi, Sherry here.
Sherry, we're gonna introduce the people on the that are here first, and then we'll come to you.
Okay. Okay, I'm sorry.
Sherry, this is Willie Harris here, and I'm here.
Uni Medlin.
Elizabeth Tustison.
We have me, Lizette Chavez.
And Chantel Davis.
All right, people on the phone, you want to introduce yourselves?
Pam here. Sherry.
Which Sherry? Sherry Coleman, Sherry Prophet, which one?
Oh, Coleman.
Sherry Coleman, thank you so much. Okay, so we're gonna go ahead and start. Maybe some people are on their way, but we'll go ahead and catch them up. So welcome. As I said, my name is Lizette, and I'm the Community Engagement Coordinator / Community Voice Council Coordinator for the Pierce County ACH. And with me, I have Chantel Davis, the awesome member with the Community Health Worker Collaborative of Pierce County. So I'm going to have her introduce herself, talk a little bit about the CHW Collaborative and what this partnership means.
So, like Lizette said, I was a previous co-chair of the Community Health Worker Collaborative and have been involved with them since 2011. Right now, the collaborative has an agreement with the ACH to support the CVC with some of their community engagement efforts, specifically getting more responses to these surveys and making sure that the CVC members feel just as supported as the members of the collaborative.
And I want to say ditto. And one of the key things that we want to do with our partnership is kind of advocate for the role of the community health worker in terms of the Medicaid Transformation Project. We know that they have very much an essential role in helping patients outside the doctor's office and helping in terms of the social determinants of health and helping people get information, resources, and just connected. Having one more person that can at least listen to them without the 15-minute limit that a lot of our medical providers are only able to give. So I was kind of hoping for more people to join us, but that's okay, because we could do this little icebreaker, which I thought was fun. We wanted to introduce ourselves, say our name, whether you're CVC or CHW Collaborative or both. And this is an idea that I got from a recent baseball game that I went to. I noticed that every baseball player has their own song that they have played before they enter the field. So I thought that was pretty awesome. So we're gonna go around and say your name and which song would we like to have been played.
Well, I'll start. So Chantel with the Community Health Worker Collaborative, and let's go with What's Up by 4 Non-Blondes.
Nice. Mr. Harris?
I guess I'm feeling in a 70s mood today.
Nice.
And the day has been a good day, so I like to have the Bill Withers song, Lucky Day.
Nice. Lovely.
Okay, so I actually had to answer this, like, not about baseball, but a theme song recently, and I just gotten off work. So can I use bad language? So I used the song Work Bitch by Britney Spears.
Barb with the CVC, and the all-time favorite, "Take Me Out to the Ball Game," is my favorite song for baseball.
Very original. Love it.
This is Elizabeth. I'm with the CVC, and my song would probably be "I'm Free" by the Soup Dragons.
Like, all right, people on the phone, your turn.
Okay, this is Pam,
Okay.
Yes, Pam.
and I like Luke Bryan. I believe most people are good.
Oh, you're such a CHW, Pam. That's awesome. That's fantastic.
Okay, Sherry, both. And for me, obviously it's going to be New York Frame of Mind.
So this is Lizette. I'm with the CVC, and my introduction song. Oh man, what was I saying? I think it would be like "Why Can't We Be Friends" by War. All right. So, all right, moving on. So we wanted to kind of do like a check-in. I know that this may seem like a very big project, but this is the opposite of what we want for it to feel like. We wanted to make it seem to where it's totally possible for many of our members. So kind of have a check-in, and this is completely honest. How many members or have done surveys or have completed surveys?
Done or you completed?
Completed, yes.
I've done 3.
I've done 3 as well.
Nice. If you haven't been able to do any, that's perfectly fine. It's okay. This is not something that you're totally obligated to. It's fine.
And I know there's quite a few of the collaborative members that are still ramping up, or they have certain events that they're doing or outreach activities that they're getting ready to go do surveys at. So there's quite a few people who haven't done many. I know that Sediva specifically came and picked up 20 gift cards for an event that they were doing at Mercy Housing and whatnot. So they're out there. Surveys are happening. But again, if we haven't done any right now, it's not the end of the world, you know?
Yeah, absolutely.
This is Pam on the phone, and I've done 2.
Nice. Thank you.
I was just going to say, also work out of Mercy House, and they are doing a fantastic job. And my co-CVC member, partner, Kathy and Maddie are working on some projects there. So
Yes.
it is coming. But I had planned on participating with them, but I talked to Maddie, and she said that they were going to take care of that. So I have my own little project that I'm going to be working on.
We're okay? It's okay. All right. That's perfect. Thank you. Thank you very much. So yeah, as a reminder, because there's not necessarily an expected number even that's asked of us, the ACH, I think what the important objective here is that we at least show that there has been some community engagement, that there has been outreach done, and that we used the already trust established with that our members have to try to outreach as many people as possible. So please don't look at this in terms of numbers. We definitely don't want to make you feel like this is an absolute competition. Everybody has their own capacity, but those who have, thank you so much. We will go ahead and show how to enter that information into the website that Chantel had awesomely volunteered to do. So what have there been some challenges you've come across with the survey?
I have had challenges.
Microphone, please.
It's burdenous. It's too much.
Too much.
I can't get, when dealing with people, if I have shown them the survey and they're like, oh yeah, I gotta run, I gotta go do my fingernails. If I can get someone to take the time to answer one question, I can get a good thorough answer. But if I ask them to give me any more time than that, it's not happening, simply because it's too much. It's overwhelming.
It's too much overwhelming in the sense that it's too many questions.
Too many questions,
questions.
and the questions have a lot of subsections.
Uh-huh.
And I understand why those should need to be answered, but
Right.
if I could approach people with more of a kind of a yes, no, closed answer, and not completely, but conceptually something a little bit more limiting, so that I'm not taking what seems to be like 3 hours out of their day. I'm taking 10 to 15 minutes at the most.
Mhm.
I will have a lot more luck to getting anybody to participate.
Okay.
But with what it is now, I live in a very retired community, and these people generally would much rather garden or anything besides think about health.
Okay. That's perfectly fine. Thank you, Elizabeth. Anybody else have other challenges that they've come up with? Well, not come up with, but the challenges they've had so far.
I think the one of the biggest challenges for me right now is that it's hard to guess how long it's going to take when you sit down with somebody. So with the 3 that I've done, it's been between 28 minutes and an hour and 20. So like 2 of them were closer to the half an hour range, but one of them, was 3 times that. So to really be able to account for that in an outreach setting or in an event, and it's just, hard. So,
Yeah. Yeah. Thank you. Thank you, Chantel. Anybody else?
I haven't done it yet, but I have talked to other people in the past when I was with other groups that did mapping. And Maria and I had planned on going down to, what's the name of that? It's a Catholic church where they do outreach type stuff and talk to homeless people. And we were just wondering, I was just wondering what kind of challenges I was going to face dealing with that, because like Elizabeth just alluded to, some people, time factor, how much do they really want to disclose to you, and especially being homeless people. So I'm still going to attempt to do that, but I just don't know what the outcome is going to be or how much I can get out of making people comfortable enough to say something. But I'm not going to give up on it, though. That's what I want to do.
I don't doubt that you are, whatever, Mr. Harris, but thank you. So from what I'm hearing is finding people who are, 1, willing to do the survey, but also 2, feeling comfortable to say or to kind of have the trust to disclose.
Okay. This is Sherry here. I did send out a massive direct mailing to a lot of my contacts and network. I got 1 response. 1 person is doing it. She sent me a list of a lot of other places I went. I've handed them out physically. I have not gotten any back. I have a couple of more meetings I'm going to and seeing what happens. I'm a little surprised of the pushback of people, because one of the main complaints I run into all the time really is asked on the survey, but then the person's willing to sit down and actually put it on paper always seems to be a problem. And then I have an appointment with the the Tacoma Urban League. I'm going to sit down with Twina, and she has a couple of meetings, and we're going to see if I can't hand it out there for people to sign and get back.
Okay, so from what I'm hearing, Sherry, it is sending it out, but not getting very much replies back.
Yeah, I was really surprised by that, and no feedback. So I'm saying, is it bouncing? Is it going to spam? But these are people I interact with a lot all the time, and there's just no response at all. So I have a couple of people that are meeting me at my office on Friday, and I will see what I can do. But it's been a lot more of a challenge than I had anticipated. Not getting to people, but just getting them to actually sit down and do it, or do it online and fill it out and send it back to me. It's just is not happening. Yeah, that's all.
Thank you.
Thank
Oh, go ahead.
Oh, I was going to say the same thing. It's given them out. I've handed them out. I've given out over 100. I've had them in our lobby, in our office, and people take it, they read it, they're interested, but once again,
Mhm.
They trying to get them to sit down and take the time, and or keeping them on track with the survey.
Right.
When we start to talk about it, then it turns into another conversation and trying to get them back to what we're talking
Yeah,
about.
yeah. So, for those who have like sent it out and kind of like dispersed it, do you kind of give your information, be like, once you're done, can you please turn it into me at this
Yeah.
email?
Yeah, I
okay.
put my work email and then also my cell phone number on there too. That
Okay.
way, I figured if it's someone that meets me through work or personal, they can all have access to the same info.
Okay. All right. Thank you.
I even added a couple of paragraphs about myself and why I'm involved with
Oh, that's
this.
awesome. Mhm.
To let my neighbors within my community know, and in the first paragraph, I sit there and say, I have, this mental illness, and I have this, and this, outing myself to let them know that, to kind of ease it for them to be a little bit more open about things for questions and answers. And everybody says, good for you, keep going. No, thank you.
Okay. Awesome. Thank you. All right, Barb, and then we're gonna switch it up.
Yeah, I've gave my 3 out, and then I made an appointment to sit down with them, and each one took over an hour doing. It was worth the hours.
So it was time. Okay. Okay.
Yes.
All right. Thank you, everybody. So, we're gonna go ahead and use this information to see how we can kind of like better support people who feel like they're not getting much back. But sometimes what happens even within the research field or within as many organizations that you see the feedback, for every one answer that you get, there's gonna be 5 that you don't. Right. So that's totally expected. But it doesn't mean that you're not doing anything right. It just means that, you either got an answer or you didn't. But either way, like you're putting it out there, which is fantastic. So thank you. But we can talk more later about how we can go ahead and improve that, or if we want to think about other tips or strategies. But kind of switching it up, have there been some successful times or any helpful strategies that you have used that you see worked?
Sherry, Pam?
Lisette. Oh, yeah.
I'm listening.
I was just going to say, with my 2 people, I used the regular survey, and then I went and used the backup one with the check boxes. And the check boxes really brought out a lot of information that they wouldn't have even thought of bringing to the table to talk about. So I use both. And I think the checkbox one really helps them understand a little more, only because that's the type of surveys people are used to doing.
Mm-hmm.
So that's what worked for me.
Okay.
Has anybody else used the checkbox one too, the backup talking point one?
Mine I've used the check boxes with, and that helped.
Okay.
Yeah.
So for those who don't know, who are familiar with what they're mentioning in terms of checkboxes, or those who will be hearing this recording, there was 2 versions that we sent out with each council. One in which it is actual survey that has all the questions that were developed by CDC. And the other is the survey with a talking guideline. And it'll, some I printed out and read edits, but those are just to have helped the members prompt the people being interviewed, give them ideas, to kind of give them some, like I said, some prompting to kind of answer possible suggestions within the conversation. So perhaps what Pam was doing is you actually showed them the talking guide, right? And they were able to then check the marks. Is that what you're saying?
Yes, I showed them the talking guide and said, now we're going to think about the main question, but here's some little guidelines that can help you think about it a little more. So I actually showed it to them. Then they checked it. Then we talked about it, and then I got an answer.
Okay. All right, thank you, Pam.
Uh-huh.
Anybody else?
I do actually have a suggestion,
Okay.
kind of off the wall. The census that the government does every 10 years, you know how the ones they don't get returned in the mail, the census worker goes out, sits down with the person in their living room and kind of stares at them until they fill out. What are their techniques? You know what I mean?
Uh-huh.
Do they have some special thing that we could learn from?
Right. You mean saying like go to door?
Not necessarily, but you know, the people that go out and get the others to fill out the census. I've had one of them come to my house once, and very nice person. I'm just wondering if there's some sales pitch kind of thing they do that might be helpful to us.
Like follow-up skills or follow-up techniques for people that we've already given the surveys out to. Is that what you're referring to?
That could be one thing, yeah.
Okay, follow techniques.
I don't mean harassment.
No, absolutely not. Yeah, and member safety. Okay.
What about bribes?
So not bribes, but with the CHW Collaborative, they do have some funding to do incentives to do like the gift cards and whatnot. So that's something that they have been using when they start forming their events. But yeah, that's something that has been helpful. But again, with the CVC, we just want to make sure this is something that for CVC, it's voluntary. For the CHW Collaborative, it is something that we partnered with, which is why they have some funds set aside to make sure that we can get as much participation as possible. Right. Okay. So, training to be an interviewer. The reason why we're bringing this up is because maybe after going through some of these slides, it could be helpful in terms of, easing the time, how to build that trust with people without making it seem like this is like 1, 2, 3, 4 question type of interview. So, but one of the things we want to make sure is the easiest thing that you can do as a person going out to community or as an interview is thinking you already know the responses, right? So what we want to make sure to do is that we want to understand what their perspective is, even if it's not necessarily what we agree on or what we think it is, right? So like say a person out in Spanaway, we see that the concern is transportation, but we're like, okay, so what do you think? What do you need to get, to your doctor? It's like, well, actually, we need something more. And it's definitely totally something different than what you thought, right? But you're going to have to take that because that's what their answer is. That's what their perspective is. And also you want to help the reader, in this case, the ACH or the collaborative or us, the CBC, understand what that perspective is. So when we try to do that, it's just kind of be very much open to what they can say or what they choose not to say at the moment. Like Elizabeth, you were saying, like they were able to answer some questions, and then they were like, okay, that's fine. That's totally okay. They don't have to answer everything, but whatever they did, what they were able to answer, perfect. Jot that down. Okay. So some of the techniques that we were recommending is perhaps like when you go through the questions, memorize them, because sometimes when you're having a type of conversation on this is another technique right there. When you're having more of a conversation with people, you're probably able to answer more than one question at the same time, right? So like instead of feeling like, what do you need to be healthy? What do you feel like your community needs? Just if it's a conversational piece, perfect. You probably picked up like where can this fits in here? Question 2, question 4, and question 5. That you will see will not only cut down on time, but you'll be able to get more answers out of it. And Mr. Harris, something you mentioned about trust, they'll feel like, oh, having a conversation with you versus let's do another assessment. Right. Okay. Thank you. And then the prompt. So Pam, something that you mentioned in terms of the checklist, that's great that you were able to get them talking with the little checklist or whatnot. But just make sure we kind of going on more under the having more of an open conversation. Could just be like, can you tell me more? You agreed with this. Can you tell me more about that? Or can you give me an example? Like, I know I gave you some of my examples, but can you give me some more examples that can fit into this? right? So we want to make, again, understanding the person's perspective, but also giving them the benefit of, you know, having their answer, their voice written down. Any questions here? Okay. So one thing that we want to make sure you keep in mind, the focus is always on the person being interviewed. Us as CBC members, us as CHWs, us as people who want to make a difference in people's lives, we know what the experiences that we've gone through, but also just keep in mind, this is about the person, right? So what we mean is like, make sure when you're talking to people, you want to build trust, but you don't want to kind of give out your own personal opinion, because then that'll kind of close a conversation, right? So like say somebody says, there was one time where my doctor was, he was really cut down on time, so I wasn't able to tell them about that other symptom. I was like, oh yeah, you know what, that happened to me too one time. This happened at that one time, and this is how I felt. That's kind of, we want to steer clear from that. Just be like, oh yeah, absolutely, tell me more. Or say if they do mention something about a negative experience at one of the agencies. For right now, I'm just using the CHC just as an example of that, not saying that it had anything happened there, but I'm just saying like, oh yeah, I heard the same thing about so-and-so clinic. That happens a lot. That's something we definitely want to steer clear from, because we don't know exactly what happened, but this is a person's experience. So let's just go ahead and say that. So some people really like to be more of an independent workers. That's great if you feel like that works, but also feel like you don't have to do this alone. You could definitely do it in pairs, or you can do it in a group setting. Sometimes when you do it in a group setting, you're able to kind of like help each other out in terms of one being the prompter, one being the recorder, and one just being there to kind of, be part of the group, so that way people feel a little bit more comfortable too. So just something that to keep in mind. Hopefully that could be a bit more easier for folks. Like the event that was being held at Mercy Housing, we have one of the members from CBC and one of the members from the CHW Collaborative. That's awesome, right? Because even if it is a large group, or whether it was a small group, that can still be helpful for people who feel less tension. Because remember, the people will feel the tension from the facilitator. If you're feeling anxious, the people will feel anxious too. So that's also something in mind. Well, actually, I wanted to see if we could do an exercise, but that's up to you guys. I just wanted to see if we could go ahead and do it here. Any questions so far before I introduce an exercise? No? Okay. So, I mean, do we want to practice? I was thinking we could do a little bit of practice session, take a couple of minutes. For those on the phone, this may be a little bit of a mute session, but if you want, why don't we, Chantel, you and I, kind of go ahead and mimic an interview? And then hopefully that'll just kind of like show people how we can, have a bit more of an easy time. So, okay. Give us a minute here. Right, ready? Yeah. Hi, my name is Lizette, and I'm part of the Pierce County Accountable Community of Health. That sounds like a mouthful, but all we're trying to do is just, kind of help people who are on Medicaid, trying to get to know more of their, what are some barriers that they may face. Even though if they have Medicaid, we all know that that's not necessarily going to guarantee my access to care or your access to care. So do you have maybe a couple of minutes or spare time to answer a couple of questions? You don't have to answer everything, but I just want to make sure. Yes. Okay. Beautiful. Okay. So just to let you know, all these questions are completely confidential. We won't be using any personal identifiable information, which means I won't be using your name. I won't be using where you live. I won't be using things that could say, oh my goodness, that is so-and-so in the community. By the way, I didn't get your name.
My name's Chantel. And that sounds great.
All right, thank you. So can you tell me a bit more about when it comes to your health? Because this is a survey that kind of deals with health, right?
Mhm.
But we all know that health isn't necessarily just your physical well-being. It's definitely a lot more about that. So overall, how do you feel when you feel like, okay, I am healthy, I am well, I can function? What does that look like?
I feel the healthiest when I feel financially stable,
Mm-hmm.
when I have an operating vehicle that I can get to my appointments and stores with. Um, I don't have any bus routes or sidewalks or anything near my house, and it takes more than 45 minutes to walk to the nearest gas station and over an hour and a half to get to a store. So, yeah.
So from what it sounds like, I hear a lot about getting to places. That's something that you have to deal with a lot
Yeah, it's a big barrier for me in my neighborhood.
in your neighborhood.
Mhm.
Okay. So besides, like when you're trying to get to the grocery store, do you feel like you're able to get to a nice grocery store, or you're able to, or do you feel like you have to make it a specific day to where you have to plan it out?
Oh, I definitely have to make it a specific day. It's a day trip.
It's a day trip.
Yeah.
Okay. And if you don't mind me asking, I mean, I know we're gonna be dealing with health. You don't have to ask. You don't have to answer this, but do you or a loved one, are they you or anybody going through any type of chronic disease, or is there a reason that you visit a doctor?
Um, for various physical and mental health
Okay.
concerns.
You don't have to disclose anything, but
Yeah.
thank you for sharing that. Is it difficult to get to, like, besides transportation, like, is that another one of the only barriers that you face?
Well, if my healthcare plan had doctors that were in my area, then it may not be as difficult, but I actually have to travel to downtown Tacoma to be able to have doctors that within my plan. So it is difficult, and I don't get to really choose my doctor as much as I would like to since my insurance has been switched. The doctor that I had for 17 years, I can no longer go to. So having that trusting relationship with somebody and then having to go and restart history has been difficult.
Yeah. So not only is it difficult to find a doctor close by, but you already established one with the good trust, and then that already moved.
Yep. And now I can no longer, unless I can pay out of pocket, which I can't afford. So.
Does your plan didn't require you to have out of pocket costs?
If I want to see the specific doctor that they don't choose, then yes, I have to pay out of pocket.
Okay. All right. Thank you very much. And sane. Girl, your microphone was not on. Oh, you did. Okay.
I just turned it off. I'm good.
Okay. So what did we see there? Apart from the fact that the interview was being very nervous.
The interviewer didn't seem to have any confidence.
Right. Did that make the person being interviewed feel uncomfortable?
It would make me think that they had no idea what they were doing. And that maybe I'm just wasting my time, because who knows if what I'm saying is actually going to make it anywhere.
Right. Okay. Thank you, Elizabeth. Anybody else?
I don't know. I guess I didn't feel that way. I thought you did an incredible job to me. I mean, you introduced yourself properly, I thought, and you said what you represented the organization that you were from. And I don't know. I just thought that you asked her. I thought that she engaged. One thing you did, you guys engaged with each other, and I thought that was a good thing. She was able to disclose right off the top a lot of different information about herself. She had problems with transportation. issues like that, and it seemed okay to me.
Right. Thank you. And thank you for the compliment, Sherry. But thank you.
So I was just gonna say, at first I got a little distracted because like when you're asking a question and then you stopped and she started answering, then you're like flipping through your pages and
Mhm.
looking. So to me, I think I probably do that myself too.
Yeah.
And so, but being on the other side of it, it's like, oh, the person almost looks kind of unorganized or confused
Yeah.
or lost.
Yeah.
And just being the person being interviewed, it feels far more engaging when the person's making eye contact with you and not reading the questions off of the paper and kind of knowing what the next question's going to be in like a segue. Like I could tell when you knew what
Yeah.
the next question for sure was
Yeah.
supposed to be versus, backwards. So I don't know. It's
Yeah,
just those little
definitely.
things that people get.
Thank you. Yeah. So, I mean, just things like that when you feel prepared, just make sure exactly what you want to ask people, right? If they get stuck, know the prompts, what have been some successful things that other people have responded well to. But if you saw when asking one question, she was able to answer 3 for me, right? The fact that, okay, so transportation is definitely an issue. But why is transportation an issue? Because she can't get the grocery store to the closest grocery store. Another thing is that she's not able to get doctors within her network, right? So like even though we were improvising, but like right then and there, you were able to kind of hear, okay, these are definitely some topics that could fit into question 5, 6, 7, or 8, right? So it doesn't have to be as multitasking as going by order, but if you feel like you can at least memorize it and know, you guys know your people, you guys know your community. If you can find it to where you can have this more as a conversational piece, the way you know how to communicate, perfect. Because that way, you can at least feel like you're able to connect with the person, like Mr. Harris said, engage with one another. All right. So that might not have been the best example, but I mean, like at least give some tips or some strategies of like, okay, what can help you next time? Okay. So one thing that we wanted to kind of use this training for is to show you how to input the information you got into SurveyMonkey. Anybody heard of SurveyMonkey before? You heard about it. So SurveyMonkey is this one website that can help us develop this survey into an online version, cutting down on time in terms of how much you have to store it into everything. So some people may be computer savvy, some people might not, and that's totally okay, which is why we're going to go through the survey or the website to show exactly where you can input and how you can input it. For those who don't have access to a computer, that's totally okay. I will be sending screenshots of this SurveyMonkey already, but if you don't have access, go ahead and give it to me or give it to Chantel. We'll go ahead and type it in for you. That we don't want that to be a barrier for you. Okay. So let me go ahead and set this up. Can people hear me? Okay. All right. So let me go ahead and close this.
So one of the goals of this SurveyMonkey was so that it could capture both the data for one-on-one sessions and as well as if you guys do surveys in group settings.
Right. As you'll see here, give me a minute here. Yeah. So if you want to go ahead and put your name, it's okay if you want to put your name so at least we know who were the ones that did the survey. So we'll put like now. Was it at the setting that the survey taking? What setting is the survey taking place in? So in this one specifically, we're going to go ahead and just put in a group because what I'm hearing, the majority have been doing the group sessions. But I just wanted to show you how it would take you. You click on in a group. You go ahead and click next. And it'll take you to this page here. And what it basically says is all the following information is assumed and based around your best guess. Please do not worry about being too specific, missing anyone, and etc. You're doing a great job. You can go on next. What is the zip code that this group event took place at? So, I mean, you can find out on terms of like the building address or whatever. So you can just say, for instance, here it'll be like 98405. That'll just tell us exactly what areas were we able to capture. Using your best guess, what were the assumed age ranges for the people we surveyed? So say for this group, will just be early 20s. You're very welcome.
Lisette, this is Pam, and I'm
Yes, ma'am.
sorry I didn't get the link into the Survey Monkey, but also I have to go to my next meeting. So thank you. I will get back with you to learn the Survey Monkey, okay? Thank
That's
you,
completely
everybody.
okay. We'll go ahead and send out the screenshots. No worries.
Thanks. Bye-bye.
Bye now. Okay. So using your best guess, what were the assumed races of the people surveyed? Sir, this is where you can do the all, check all of that apply, right? Because you don't want to be like, oh, they're all, one. And it's like, no, we need to be all inclusive here. So we'll go Asian, white, other. Oh, Chantal.
I was just gonna say that, like, with the group survey input, that's like, this is the only part that's really different, because we're not actually asking when we're on one-on-one. We get to that last page and then we actually ask for where you live, what's your zip code, what do you identify, like what other special populations. But in a group setting, we're trying to concentrate more along with the actual survey questions rather than who necessarily we're surveying, and not making that a major concentration. If we have a group of 20 people, we don't want to spend an hour just getting demographic information. We want to get to the actual core, the nut of what we're trying to do here. So I just wanted to like kind of reiterate why this for a group setting is all of a sudden assumed demographics rather than actually asking everybody.
Thank you. Everyone okay with that? So click OK. Using your best guess, again, what are the assumed ethnicities of the people surveyed? Were they Hispanic or Latino, non-Hispanic or Latino? So with this, these are kind of going by what the healthcare authorities, traditional metrics that they would use. So that's why we have them in here. So using best guess, would be like, well, I'll include myself in there. Why not? Using your best guess, what were the assumed genders of the people surveyed? Now, this is going to be where you can, again, use the community. So if they are either identifying as like one gender, like cisgender, meaning male biology, male orientation, male sexual orientation. But if you have a group where you know that there is diversity, just go ahead and click on gender diverse.
I have a question about that one.
Yes.
It says, it doesn't say identifies with, a gender up there. You understand the difference?
Yes. So what were the assumed genders of the people surveyed? So would you say what were the assumed genders people identify as?
Well, I went to the Rainbow Center last night for the chat, and there's probably 12 people in there, and a lot of them identified not as male and not as female.
Right.
And so I'm looking at these people would say, well, that person looks like a female and that person looks like a male.
So
would I be answering that question with what I feel they look like to me, or how they identify personally?
Female, male, and gender diverse. Like, you could select all of those.
Okay.
And really it's up to, so you built some trust and like a rapport with somebody, hopefully with this last half an hour to an hour and a half that you're with somebody. So really it's just your best respectful guess, you know what I mean? And when you're, at like the Oasis or like the Reach Center, and you are primarily working with LGBT and people who are gender diverse or trans, you can totally just select gender diverse, or, if they are like, that they strictly identify as female, then it's female.
So this is more of the interviewers
Yeah.
general idea of what was the gender was. They were-
Within the group setting.
Okay.
And again, it goes along with city, county, and HCA metrics on
Mhm.
how they're reporting right now for both for race, ethnicity, and gender.
Thanks.
Thank you, Elizabeth. That was actually a good question. So here you can put the majority of the people speak English, or did the majority of the people speak a different language, or if they were both English and a different language, you can also just write that down here.
And again, if you didn't have to do any translating services or anything like that, then you can totally just assume that the primary language is English. But if you actually had a translator come in, or you guys went, something along those lines, then that's when you can go ahead and throw those in there.
Thank you. Okay, and of course, this is a demographic question. Who's your best guess? What were the insurance covered by the people who were surveyed there? So if you know it's a group who are a mix of uninsured and Medicaid eligible, great. If you know it's a mix of private or employer sponsor, that's questionable because our target population is Medicaid. But I mean, if there were some in there, okay, fine. Oh, parents, right? So again, using using your best guess, we'll have education. I don't know, some people disclose whatever, you can just go ahead and disclose whatever. There it is. And then there are no wrong answers. Absolutely none. Again, so very, very helpful reminder, if someone chooses to skip or not answer a question, when entering that feedback or the answer, just go ahead and enter NA, meaning not applicable. So this is where you would literally write down everything that they mentioned. Not everything, right? But the bullet points. This is where you can write down the bullet points. So a little bit about the community. Lives in a small area with little to no transportation. Or if they mentioned something else, like tell me a bit more about your community. Like I wrote down something like I feel I represent the immigrant community. My parents immigrated from blah 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 country. This is how I like to identify. Oh, but then again, because this is a group setting, this is one thing where you can be like, I actually interviewed people who are chronically homeless. I interviewed people who are disability. I interviewed people who, lack certain resources. Okay. So what does healthy being mean to you? Again, this is where you would write down all the questions. All the answers. Now, it is very easy to want to write down literally everything that they all said, word for word. That is a little tricky. But in certain situations, there are some people who kind of have this one statement that's really pretty much all encompassing, right? Like she said, I have to travel to further along the ways because there's not many people within my network. So I have to go somewhere that does have my network. So things like that, you can go ahead and just write it down in quotes. Within my network, you guys get the clue. Like that is a pretty cool all-encompassing statement. But if they go ahead and say things like, I just feel like I'm tired most of the time because the bus comes late every day. And honestly, it gets me so upset, but then my anxiety level reaches a different high. It's so easy to go on that tangent, but just make sure you kind of grasp the main point. What is it that causes anxiety and why? Boom. That's all the answer to it. Okay. So what do you need to be healthy? What keeps you from being healthy? So in this, I was thinking about this question because I even answered it. Last night I was trying to go through it. What current illness/conditions are you or the people you love or the people you work with are facing? So this is one of those things where you can click on one because some people have only chronic illness. Some people only have mental health. Right? Some people only addiction. That's where you exactly right. So there's definitely a fine line between the combination of two, or some people can have separate types. This is where you would go ahead and click the multiple illnesses. So they have chronic and behavioral health and multiple.
And I think that, and correct me if I'm wrong here, but I think that we chose to go with multiple illnesses rather than selecting multiple of them because it is at the very beginning of our conversation with somebody, and it is a really private thing. So just going through and just asking and making it can be all encompassing of no, I have multiple concerns, rather than going further into detail there that you could get into more detail with your probing or follow-up questions.
Right. And this can help us in terms of seeing how, in terms of the ACH work, how all of this is really tied in together. You can't really just focus on one aspect of a person's well-being. This is another way to prove, or, if it proves, again, we don't want to assume that it's all part or it's all related, it's all entwined. So yeah, this is kind of, so you would go ahead and just keep writing. If you feel like you were like typing and you don't have much space, this is what this little kind of side tab is. You can go ahead and elongate it if you want to keep seeing your answers.
You should never run into a character max, but if you do, let me know, or Lizette, and we'll get it squared away.
Yeah, especially if you're doing it in a group setting. Of course, you may be typing in more than one answer. So this is where we would just make sure we don't have a limit, but you're able to see exactly what you wrote down that from the group set. Okay, so as you keep going down, it'll prompt you to the following question. And then after that, you just go ahead and submit your community voice. And then once you're done there, oops. Well, either way, huh? And good Lord. Why? Well, I just want to type it so that people can see. Mm-hmm. And if you feel like one question is redundant or the same as the other one, you don't have to answer it. Just go ahead and add it into that one box. And then submit your voice. And then that's it. Boom. Did your homework. Don't be worried about whatever page it prompts you on. Don't click on anything. Don't sign up for anything. But the link to the actual survey, we'll go ahead and post it here. It is www.surveymonkey.com. I don't know why it says that, but at the very end, it's a Pierce ACH community survey. So if you click it through the PowerPoint, great, but most of the time you can just, oh, no, that's not what I want. Oh, because I'm in the press. Weird.
And again, filling out the survey, I don't want that to be a barrier or a reason why someone like stops at getting 10 responses from people because they know they're going to have to enter in 10 surveys worth of data. Like I will do it.
Yeah.
Like I will do it.
So if you copy the link, paste it on the search bar, it'll take you to the right beginning again. And then for the ones who did one-on-one, same thing. All the same.
So let's say I'm get a willing participant, but for whatever reason, they have to stop after 3 questions. Do I take what I have and
Yes.
fill out? Okay.
Absolutely. If they stop at 4 or 5, that's perfectly okay. You got an answer.
So that's 4 or 5 that we didn't have before.
Exactly. Okay. So one thing to keep in mind as you're entering information, go ahead and is you just want to make sure you follow these following guidelines. Confidentiality is key. Do not put anyone's name. Don't put anyone's address or anything that can make it easy to identify the person that you talk to.
And again, we'll be going through the data at the end, and if there is anything that we see that looks like it's identifiable, that we can identify anybody using, then we'll remove it
Yes.
from the data as well. So again, don't be too scared about that and with certain information, because all of the data and the questions that we're asking are all really personal anyways. But yeah.
Yeah. And again, don't feel compelled to enter every detail of the information of the meta statement that is all encompassing, placing quotes, but you really don't have to put in. Some people love to tell you the whole story. We all know those people. I'm looking at you, Mr. Harris. No, but I'm not looking at you, Mr. Harris. I'm kidding. But that's something you just keep in mind if they go on a tangent or whatever. Just right to the point. If you feel like you got your answer, be like, thank you very much. Now next move on. So I hate to break it to you guys, but you all have homework. Everybody has homework. So what we want you to do is that we want you to take a moment and actually take the survey as well, right? Because just as much as we want everybody else's perspective, we have you for a reason, and we would love to have your perspective as well. That's okay. Yes, absolutely. I'll go ahead and print them out today before you leave. So if you wait. Yeah, or absolutely. And you don't have to put it all on paper and etc. Just go ahead and go straight to the link. Yeah, but I'll go ahead and post that as well. Any questions? People on the phone, any questions? Are you still with me?
Yeah, I'm still with you.
Any questions?
None. I'm good. I'm good. I'm good.
Yeah. Anybody here? All right. Thank
I-
you. Oh,
I actually did. I wanted to mention something when I'm out talking to people, being a CPC with active listening. Two things I do to make them feel more comfortable is I share some about myself that most people find that they need to keep a secret about themselves. But secondly, I don't make everything about bad.
right.
I bring, especially with this, I've said I would love to hear whatever you have to say, good and bad.
That's a really good point. Yeah. Thank you, Elizabeth. Actually, yes, if they say they don't have any specific fears, but they share good experiences, perfect. So that's something we can even build up on, right? Because their experience probably can help another person with their last time. But yes, thank you very much. If they do report something very well or positive, still write it down. Yeah, because that's something that can help us in terms of actual finding suggestions for solutions. What worked for them is also part of our deal. All right. Thank you all so much. Thank you for those who are listening to this recording for hanging in there with us. Any other questions, please look at the contact information. You can email me or you can email Chantel. If you need more copies of the survey to hand out, let either one of us know. We'll print them out for you. We'll go ahead and post or actually send out the link to the SurveyMonkey. If you feel like maybe handing the actual link out to the people may be a helpful tip too, that's great. Because that sometimes people can go ahead and just fill that out while they're on their laptop, cell phone, whatnot. But yeah, thank you everybody. And the collaborative, yeah. Yep, I'll go ahead and send it out to CVC and the collaborative. That's what the question was. All right, thank you everybody. Thank you everybody on the phone.
Bye-bye.
Bye.